UNODC Opioid Strategy is a 5-pillar integrated response to the opioid crisis. And with the current COVID-19 global pandemic, we find ourselves in a complex situation of dealing with a dual health crisis. Today, I'm glad to be speaking with Martin Reithelhuber, Program Manager of the Global Synthetics Monitoring, Analysis, Reporting and Trends Program, also known as the UNODC Global SMART Program, which is a collaborative partner of the UNODC Opioid Strategy that is working to advance early warning and trend analysis around the world. Martin, thank you so much for taking the time to speak with us today.
Pleasure to talk to you today, Asma.
So Martin, I'll start with a very quick question about early warning systems. We know, of course, early warning systems depend heavily on the ongoing flow of information and data and trends related to synthetic drugs and synthetic opioids, nationally across different sectors, but also regionally and internationally. And in the context of this dual public health crisis, the opioid crisis and COVID-19, how has this affected or influenced the availability of such data and reporting? And why is it important to ensure the continued and consistent monitoring and reporting on synthetic drugs, in particular synthetic opioids?
Thank you, Asma. The Global SMART program was set up to monitor and analyze change. Let's look at Asia, for example, where methamphetamine production has increased massively in recent years. In our report on synthetic drugs in East and Southeast Asia released last week, we argued that the COVID-19 pandemic will likely not affect methamphetamine production much, but the impact on local distribution systems and on the ability of governments to provide services for drug users could be huge. I'd like to thank governments in the region for their collaboration, because it's their data that helps us to understand the situation and to identify the most recent developments and changes, also those related to COVID-19. A word of caution here, maybe, let's not underestimate the ability of drug traffickers to adapt very quickly to new realities, including COVID, because that's what we have seen in the past in all regions where we've been working with the Global SMART program.
Thank you, Martin. And speaking of some of these reports that are emerging, we've seen some reports that indicate that there is a decrease along the traditional routes in the trafficking of the precursor chemicals that are used in the production of synthetic drugs. And from the vast reach of the Global SMART program, have you seen any indication of alternative trafficking routes for these precursor chemicals, and in particular, or of any alternative production hubs that are emerging?
Yeah, definitely. It's an extremely dynamic market, the synthetic drugs market. And to put it simply, synthetic drugs can be manufactured anywhere, anytime, with the right knowledge and equipment, and of course, having the precursors. That's the main difference to plant-based drugs like heroin and cocaine. No precursors, no fentanyls, no synthetic opiates. And some analysts have predicted such interruptions. But we need to consider that cartels have been extremely flexible and innovative in the past, replacing one precursor with another, or changing the whole synthesis route. The very fact that fentanyl and its analogs from Latin America have become a part of the opioid crisis demonstrates this flexibility. Mm-hmm. And apart from changing routes to less monitored countries, there is still a lot of scope for traffickers to use uncontrolled precursors available from alternative illicit sources. And there are indications that they're doing exactly that. And I would expect they're doing that even more so in the context of the COVID crisis. Mm-hmm. The most recent Global SMART update explains that in great detail. And it's really important that we set more focus on precursors, and particularly in regions like Latin America and Asia, where we are working in the context of the UNODC Opioid Strategy.
Thank you, Martin. And speaking more specifically about the Global SMART program, how does the Global SMART program respond to this complex situation of a dual crisis, and continue to support its network of early warning systems around the world in responding to these challenges that are posed by synthetic drugs and synthetic opioids, in the middle of the social distancing, distancing measures that are put in place? And more so, if you can also speak a little bit about how countries can benefit from the associated capacity building activities, particularly during this challenging time.
Yes, they can. Synthetic drugs and synthetic opioids don't show up much in drug statistics, for example, in Latin America and the Caribbean. But from the early warning systems in the region and from our own global early warning system, we know that synthetic drugs are an important part of the drug demand reality in those countries. Early warning systems complement existing drug monitoring networks, and they're an important element of the overall understanding of the situation. And that's exactly why we have started to support forensic early warning systems and synthetic drug identification in Latin America and in South Asia in the framework of the UNODC Opioid Strategy. So the awareness and the knowledge of synthetic drugs in those regions is still comparatively low. But through the capacity building activities of the Global SMART program, this is changing. Already last year, we started offering webinars, and now we're increasing these activities as long as we cannot do face-to-face trainings. And we're also moving other technical collaboration activities online. So we are ready to continue, but also to expand this work, also under the conditions of the global COVID pandemic, as a partner of the UNODC Opioid Strategy.
Thank you so much, Martin. And I'm very much looking forward to reading the guidance and the insights that are presented in the Synthetics Drugs in East and Southeast Asia latest trends and challenges report that you referred to earlier. And thank you, and thanks to the Global SMART program for their continued collaboration with the UNODC Opioid Strategy and bringing real solutions to member states. And lastly, we're looking forward to seeing you on the other side of this pandemic very soon.
Likewise, thank you very much, Asma, and we're also looking forward to continue working with you and the UNODC Opioid Strategy. Have a good day.